As I told you all earlier, Larry Wallach, Dr. Larry Wallach is going to be talking to us about touching on developmental origins of disease, epigenetics, things of that nature. We talked some about that yesterday. I know it's of interest of many of yours. And just to tell you a little bit about Larry, is he was previously the dean of the College of Urban and Public Affairs, which is what houses the School of Community Health here at PSU. And he is I was going to say a nationally renowned scholar. He's an internationally renowned scholar who is he's a personal mentor of mine. We also share the European connection, so that goes deep. He is currently now working as a researcher, as a faculty member in the School of Community Health, and just brings so much wisdom, so much expertise, and I'm just really thrilled he took the time to be able to be here with us today. So I encourage you, if you have questions, take the opportunity to ask those questions while he is here, because there is a lot of brilliance right here with Dr. Wallach. And with that, I'll sit down. I think very highly.
Thanks very much. And I'm really happy to be here today, and I have to tell you that you may not understand it sitting there, but when somebody like me, who's been working in public health for 40 years, walks into a room like this, everything changes for us. Because it's been such a struggle over all these times to create a difference, make a difference, create change. And you guys pay attention to the news. You know all the stuff that's going on. But for me, when I walk in a room like this, it's sort of everything changes, because I say, these are people who really want to make a difference. These are people who are going to continue on and have a greater impact than my generation was able to have because of some of the things we were able to do. So I just applaud you all for being here. I'm very excited that you're here. You should be excited. And I'm grateful to Carlos and to Dawn and all the faculty who took the time to put together this proposal to make this successful. So again, congratulations. So I want to start out by giving you a bit of a quiz, non-graded quiz. But I want to know how many people, and just let's raise our hand, which countries have a longer life expectancy than the United States? Is it Korea? How many think it's Korea? Somebody from Korea. Is somebody from Korea? How many think Greece? 1, 2 people. How many think Japan? A fair number of people think Japan. Okay. How many people think it's all of the above? All of these countries do. And how many think it's none of these? Well, you guys are pretty good at this. It's all of the above. The United States, which used to be up in the top 5 about 20, 30 years ago, now is at the absolute bottom of the 19 highly economically developed countries. This is a remarkable thing. That you take all these other countries that we compare ourselves to, and when it comes to life expectancy, we're absolutely at the bottom. The second thing is, so life expectancy is one of the measures that is used internationally as a way of comparing countries. There's lots of different measures. But the two top are life expectancy and infant mortality. So I want you to think hard about this. Which countries have a lower infant mortality rate than the United States? How many think Spain does? A couple of people. How many think Italy does? A couple of people. How many think Norway does? A few Scandinavians. Norway countries are pretty well known for this. How many think all of the above? And how many think none of the above? Oh, it's actually kind of not quite split, and the fact is, it's all of the above. All of the above. And again, when you think about this, we are the richest country in the world. Infant mortality is a measure of what happens to the most vulnerable population we have, which is women who are pregnant and children that are developing. And we are at the absolute bottom. So the third one, again, and this is something you probably know, which country spends the most on healthcare? So, Japan has the longest life expectancy. I mean, you probably know that. Which country spends the most? How many think it's Japan? They have the longest life expectancy. How many think it's the United States? How about Canada with their cumbersome, expensive health, single payer system. No? How about Sweden, the Scandinavians, where they give everything to everybody? It's the United States. Spend at least twice or 2.5 times as much as most other countries and have less productive outcomes for that same cost. But here's something I'm sure you didn't know. When you look at our Western comparators, Northern Hemisphere Western comparators, and you look at the money that is spent on both healthcare and social support services, there's not much of a difference. It's just that the United States spends most of the money on healthcare, whereas other countries spend a lot more on family and social support programs, social safety net kinds of things, guaranteeing basic goods to people. So what we know is that it's not the amount of money that exists in a society that a society has. It is how that money is distributed. So this leads to 4 things that I've learned in public health. Notice I started there. 4 things. The first thing that is very important for people looking at developing a science career and developing a career possibly in health-related areas is that health is the product of how we organize ourselves as a society. How we organize ourselves as a society is rooted in the value of social justice. Social justice basically is the collective decisions that we make as a society that are reflected in policies on how we organize ourselves. In public health, we have a saying that the public policies that we pass today can be used to predict the public health problems that we face tomorrow. Many people in public health believe that the fundamental issue in public health is justice, and that health is related to justice, and I'll come and talk more about that. But this idea of social justice, the way that we collectively decide, because it's about all of us, to organize our societies through the public policies we support, policies that increase opportunity for some and possibly inadvertently decrease opportunities for others, policies that disproportionately put the burdens on different populations while freeing other populations. The second thing that follows from that is that social inequality is related to health inequality. And what we know from all of the, one slide I didn't show you is that when you look at what's known as the Gini coefficient, which is a popular measure of the level of inequality in a society, the United States is at the bottom of, again, the 17 countries we compare ourselves to in terms of the Gini coefficient, which is the level of inequality. So we know that social inequality is directly related to health inequality. And this is what gives rise to the social determinants of health, that I'll talk a little more about today. What are the social determinants of health? This also tells you, very importantly, that if you want to improve the health of a society or the health of a community, you cannot do it by just focusing on the healthcare system. Because most of health is produced outside of that system. The healthcare reforms that President Obama put in place, they're all good. They're all a contribution, but they're a long way from what it will take to make us a healthy society. Healthcare is part of the solution, but it's not the whole solution. And this is a very important thing to remember. The third thing is that public health is involved in dealing with populations, not just individuals. You know, one way of explaining this is the forest versus the trees. Medicine, medical care, a lot of the curative stuff that people are pursuing focuses on the individual trees. How do you take care of those trees that need help? What public health is about is cultivating a forest, the ground in the forest, so the trees can all be healthy. And we don't deal with them one at a time. So this population focus is extremely important rather than an individual focus. Think about the issue of obesity. You know, our society has a tendency to focus on big social and public health problems and reduce them to their individual level and to think about the problem at that level. So obesity is thought about the lack of exercise and just poor food choices. But there's a whole environment around individuals that constrains the choices that people can make. One of my colleagues, a public policy professor, used to be at the University of North Carolina, Nancy Milio, used to say that what we need to do is create environments that make health-promoting behaviors as easy as possible and health-damaging behaviors as difficult as possible. And what we've done is exactly the opposite. I was really amazed the other day to see, and this stuff can be tricky, where the General Mills, one of the biggest cereal companies, is taking the artificial coloring out of their cereal, and they're touting this as a big health benefit. And I was sitting there thinking, you know, if they really wanted to do something, they'd reduce the sugar content of the cereal. Because sugar is really, in terms of a health impact, is going to have a much greater impact than the food coloring. And reducing the number of Trix colors, you know, in the Trix cereals from 8 to 6, because there's 2 that they can't do with our artificial food color. Yet they will be hailed as doing a great thing. And it's not a bad thing to do, don't get me wrong. And they should be complimented. But there's a greater good there. And what happens with incremental approaches is that we continually accept things with the idea that they're going to lead to this greater good, but oftentimes it's necessary but not sufficient for creating the change we want to see. And the fourth thing is what I'll talk a little more about later is developmental origins of health and disease. And this is the idea that chronic diseases and some cancers that we thought originated later in life, that were a product of the genes that you inherited and the lifestyle choices that you made, actually began in the previous generation and through the first 1,000 days of pre-pregnancy through the first 1,000 days. And that these are products of 2 major things. Number 1, the nutrition that people get, and number 2, the level of stress that people are under. And this is what has now become to know, is the epigenetic issue. Epigenetic means that it is on top of the gene, not in the gene. And I'll come back and talk more about that in a bit. So the key public health points that you need to know, and these are good general points, is that health education may be necessary, but it's not sufficient to promote the health of populations. That national educational programs about diet, about exercise, about smoking, all of these things are a little bit of a part of the solution, but they're not the whole solution. In fact, they can actually be part of the problem rather than part of the solution. And they can do that by inadvertently placing the responsibility for change on the individual when the individual doesn't have the latitude of decision making that is required to do what is being asked for. And there's just this has been one of my areas of study over the years, and I could talk to you a lot about that. But this is a very significant issue. We want health education to help people as part of a much larger thing, part of a much larger intervention and a program of social change. When we just do health education by itself, it's really a form of blaming the victim for the problems and putting the entire burden for change on them, rather than looking at the environment or the conditions that give rise to and sustain the problems. So the second thing is that the policies that govern the conditions that give rise to such high levels of illness and disability in our society need to be addressed in order to create change. So you need to deal with the context. And the third thing is, and this is very important for you going into science, science informs but doesn't determine. If the world today were based on what we know from science, it would look a whole lot different than it is now, and we'd probably all be a whole lot healthier. But the fact is that this is a political process that we're involved in, and that science is interpreted through different lenses. Just like you, and you heard this in the previous talk, I caught the end of it, and it was a very good talk. I wish I was here for the whole thing. But you all have a lens. I mean, this is a different talk I give on perception, but you have a lens. And you understand that world through that lens. And it's not really about truth. It's about what fits most with your value system. And you ignore certain things because you say, oh, no, that was never like that in my family. And you accept other things even though they may not be universally true because, yeah, that was what my experience was. So a lot of this is about perception. And you can't think that science is going to find the truth because it's only one part of the truth equation. So a core public health principle, Jeffrey Rose was a very important physician epidemiologist in England. He wrote this book, Strategy of Preventive Medicine, very thin book. Those of you who are going in public health, by the way, this is a guy you need to know about. Especially those of you, by the way, who might be thinking about going into the medical profession, becoming doctors. This is a very important guide for understanding the difference between the forest and the trees, difference between medicine and public health, difference between focusing on high-risk populations and focusing on the general population. Primary determinants of disease are mainly economic and social, and therefore its remedies must also be economic and social. Medicine and politics cannot and should not be kept apart. So anybody who tells you that science is not a political process, that's wishful thinking. It shouldn't be a political process, but it is, just based on what questions you decide to study, what research you decide to undertake, what variables you decide to highlight. It's all a subjective process. The measures may have a degree of objectivity, but the process is very much of a subjective process. So what are the social determinants of health? The conditions in which people are born, grow, live, and age. The context in which we exist. They're shaped by the distribution of money and power and resources, not just at the local level anymore, but at the global and national level. It really is about money, power, and how resources are distributed. Now, it's not like all of you are going to go out and say, okay, I'm going to change the distribution of money, power, and resources. But you just need to be aware of this stuff. You need to be aware of it because it influences. It influences whether you're here today. It influences what your opportunities will be as you go through and as you graduate and get out there in the world. And it certainly influences for those of you who have an ultimate goal of real social change, what some of the challenges are that you will need to take on. And these social determinants are mostly responsible for health inequities. Health inequities are the unfair and avoidable differences in health status seen within and between the countries. And within our case, as you'll see, within counties, within communities. Now, another thing, which is a paradox in the United States. Remember, I just told you, and you guys were really good on the quiz, about how we lag behind other countries. But the interesting thing is, every year, life expectancy increases in the United States. We're getting better. If you look at infant mortality, which is a major indicator among African Americans, it's been cut in half, from about 18 per 100,000 down to 9 per 100,000. Yet the gap between the African American community on infant mortality and the general community has not changed. So even though there's been declines, the decline has been equal or greater in the general community. You had a question?
Yeah, real quickly, the time span that you're referring to right now.
The time span would be in, I was just reading something on this, in 1950, it was twice as high in the African American community. Right now it's 2.5 times. So over that. And during the civil rights movement, a lot of social change, it actually went down and then it popped back up. And part of this is due to the economic stuff. So let me just, I don't want to get too away from my text here, but you guys need to think about this, because when you look at stuff today and you say, you know, it's impossible to create these changes. We've done this in the past. So from World War II up until the 70s was what the economists call the time of the great economic compression. The level of inequality, economic inequality, income inequality in this country went to its lowest level since we started keeping records about it in the early 1900s. In the 1970s, things begin to change. And you'll hear today on the news oftentimes when people talk about wages, that wages begin to stagnate in the 1970s. That relative wages have not increased for families since the 1970s. This is remarkable. But what happens is that in the 1970s, because of political and social changes, economic inequality starts to rise. And then by the time we get to 2000, the early 2000s, it's at the highest level it's ever been. And what happens with economic inequality is that the benefits of the good economy get concentrated in one part of the population, and the disadvantaged population gets more disadvantaged. So you see this growing gap, and that's what we've seen in the United States. And this is worrisome. This is troublesome. Even really, really rich people know how bad this is, because it threatens social tranquility. And for anybody to do business and do well in this country, you have to have a measure of predictability and social tranquility. And when you get a level of inequality this high, it becomes problematic. So developmental origins of health and disease. So, you know, I didn't know anything about this till about 4 years ago. And I heard somebody talk on this who ended up to be one of the leading authorities on this and works up at OHSU, and I have been teamed up with him ever since, working on how do we translate this science into public benefit. And you can read this, and by the way, anybody who wants these slides, I'm glad to give them to you. But these are the things to remember. That vulnerability for chronic diseases, heart disease, diabetes, obesity, stroke, hypertension, vulnerability does not begin later in life. It is actually established developmentally and at birth. This is not certainty. This is vulnerability. So we talked about the first and the second hit. The first hit is the vulnerability you're born with. And we all are born with some degree of vulnerability, because we're all going to die, right? Nobody gets out of this thing alive. But the second hit, which will contribute to whether that vulnerability translates into disease or not, or what level of disease, is the continuing impact of the environment as we age. And again, that environment is linked to stress, nutritional stress, social stress, and exposure to toxins. So this begins earlier in life than we thought. An indicator of this, but not like the do-all, be-all, and end-all metric, is birth weight. And I say that because I don't want everybody to think, what was my birth weight and does it predict? Birth weight is associated with lots of problematic things. Lower, very low birth weight is associated with an extremely high risk, 4 to 5 times greater than sort of sweet spot birth weight of heart disease 60 years later. A much higher risk of diabetes, higher risk of obesity, higher risk of some kinds of cancers. Birth weight, and they did a remarkable study in Florida where they followed over 10 years, I think it was 1.3 million births, and looked at their test scores. Birth weight, direct line in terms of test scores. Lower birth weight is associated with lower test scores. By the way, the impact is greater if the mother did not have a high school education versus a mother who had a college diploma. So if you have a low birth weight baby born to a mother without a high school education, that test score is going to be lower than a baby born at the same birth weight but to a woman with a college education. And this is the impact of the second hit, right, of the environment. So birth weight is an indicator. It's not certainty. It just is an indicator of the problem. And the reason why it's an indicator of a problem is because during the developmental period, when there's the mother's under high levels of stress, what's known as chronic stress or toxic stress, and number two has maybe a lot of calories but limited nutrition, developmentally the baby is making trade-offs. And those trade-offs are such that they are reflected in slower growth and lower birth weight. So the genes we inherit, I should have used this question, I would have got you. The genes we inherit play a relatively small role in population levels of chronic diseases. Some estimates are maybe 10 to 15%. But embedded in us is this notion that it's about our genes. You hear somebody dies young, and what's your first thought? Bad genes, right? So the genes actually play a smaller role than we thought. This is a revolutionary concept. How our genes are silenced or activated is a result of interaction with the environment is key, and this is the epigenetic process. That our genes are actually listening to the environment through the mother, and then later on directly. They're listening to the environment and getting messages, and then adjusting its growth to respond to the environment. Now again, I'm just giving you the general overview of this. You can appreciate that we could be talking about this for a long time. But the key point you need to take away from this is that the epigenetic process is the way that nature meets nurture. It's how the environment literally gets under our skin, creates biological changes that affect our probability of health and disease throughout the entire life course. Epigenetics, it's a mark on top of the gene that takes the gene and tells it how it should be doing its job. A scientist compared this to think about your genes, the genome as a computer, the hardware, right? You've got this hardware, and then the epigenome is like the software that tells it when to work, where to work, and so forth. Tells the cell, you're a heart cell, you're a liver cell, you're a brain cell. And if it's turned on or off and it's not giving it the right message, then there becomes a problem in terms of health and disease later. The time when this impact is greatest, it happens throughout the lifetime. I'm over 60. If I go out and do intense exercise, there'll still be epigenetic changes in my body. There's some good research on this in terms of how fat is burned and so forth. But the time it's absolutely most sensitive is pre-pregnancy, right at that point of conception, preconception, embryo formation, through the first 1,000 days. When you are born, most of your organs, except for the heart, the immune system, and one other thing which I forget, are pretty much fully formed. Right? So your kidney and the filters, the nephrons that filter impurities and so forth and affect blood pressure. When you were born, the capacity of that organ is pretty much set. So if trade-offs were made developmentally in the womb because there wasn't enough energy going to the baby, and the baby said, well, mom is filtering out all the impurities, the kidney's not that important, I'm focused on immediate survival, it's going to shift development from the kidney, say, to the heart, or the brain. The brain is the thing that consumes most of the energy. Nature and nurture are inseparable. This means that if we focus our attention on changing environments, we can ultimately change our biology and change our health. This is the core of social determinants of health. So in public health, we have a wonderful metaphor. And that metaphor is the upstream, downstream metaphor. So I'll tell you how this works. There's three people alongside a river. And all of a sudden, there's a cry for help. Somebody's drowning in the river. So the first person is a public health person. The public health person jumps in the river, pulls the person out, and starts to resuscitate him. The second person is berating the person who just got pulled out, saying, what's wrong with you? Why can't you swim? And the third person, very entrepreneurial person, is giving out discount lessons, for discount coupons for swimming lessons. Well, as time goes on, more and more people float down the river. The public health persons can't pull all the people out. Other people come down, and everybody's watching and doing what they can. And epidemiologists come down and they start counting how many people are going by, and what the characteristics of the people being pulled out, and those who fall back in, and what's their age, sex, demographic background. We're in Portland, so some food carts start getting set up. It's just a lot of stuff going on, and what's happening is, for every person they pull out of the river, a couple float by because they don't have enough people to pull them out, and some of the people who get pulled out fall back in. So finally, somebody says, we're so busy pulling people out of the river, we don't have time to go upstream and see what's causing people to fall in the river. What kind of barriers do we need to build upstream to prevent people from falling in the river? This is what public health is about. Public health is about going upstream and pulling people out of the river, because ultimately it's cheaper, it's more humane, it's more productive, and it just makes more sense. But we're a downstream society. We tend to wait till people have problems and then blame them for having problems. What's wrong with you? Why can't you swim? Get yourself some swimming lessons. Be better prepared. So the mission of public health is going upstream. Going upstream is difficult, though, because sometimes the upstream cause is really distant from what's happening downstream. I mean, if I start talking to you about heart disease, and I start talking about the lack of nutrients for pregnant women, you're going to say, man, that's pretty far way off there. Why don't we just get people when they're in their 30s now to smoke and to exercise more and so forth? Also, if we go upstream and we look at the conditions that give rise to and sustain the dangers upstream, we're really looking at social arrangements. We're looking at corporations. We're looking at food companies. We're looking at alcohol and tobacco manufacturers. We're looking at economic systems that create risk by institutionalizing greed and creating policies that put some people at a great disadvantage. So the upstream stuff is pretty controversial. So what we mean when we talk about this is upstream is broad social change. How do we rethink the environment in terms of equality? So when you think about upstream change, so broad social change, it's a change in how we think about the world. So if you think about something like same-sex marriage, this is social change because it changes how people perceive the society and the world. It's a remarkable thing because, I've lived through that process, and the speed with which that social change occurred could not be predicted. It wasn't long ago that people were fighting for domestic partnerships. And all of a sudden, then domestic partnerships became kind of the consolation prize. Now entire countries are making this change. Another example of social change just happened the other day with the Pope and making environmentalism an issue of social justice and talking about the fact that it was the poorest people that had the greatest impact on it. That's what we call reframing. That may lead ultimately to the social change that is required, both because of his moral authority, but also because of the reframing of it as this issue of social justice. That may lead to the kind of change we need to make. The second level, the midstream level, is specific public health policy change. For example, I showed you how bad we're doing in this country on a lot of health outcomes, but one of the places where the absolute best is smoking and tobacco use. And a lot of those changes, increasing the tax on tobacco, reducing the level of advertising, reducing the places where people can actually smoke. We have been the leaders in that. We've done a really good job on that. If we hadn't, we'd be even a lot worse in terms of health stuff. So there's a lot of public health policy change. I'll give you another example, automobiles. The rate of automobile crashes and deaths in this country have just plummeted. Just plummeted. On a per mile basis, and it's just gone way down. And one of the things that happened, big public health change, of course, was airbags in automobiles. That's a specific public health change, not really a broad social change. It was about a specific policy. But it was linked to broader social change and understanding the role of the immediate environment, the car environment, in terms of injury prevention. And that tracks back to Ralph Nader and also to some specific public health people. Another thing is, this is the downstream thing, behavior change. Trying to get people to change their behavior. It's a necessary, but it's not a sufficient thing to do. It's a lot easier to get people to quit smoking when the entire environment is organized around a stop smoking or limited smoking or smoking is an unhealthy message. So this is just something to think about. This guy is now the head of, Friedman is now the head of the Centers for Disease Control. When he wrote this, I think he was the commissioner health commissioner in New York. But the greatest impact, the health impact pyramid, is focusing on social economic factors. The least impact you get is counseling and education and clinical interventions, but we focus mostly up here, less down here, because focusing on the individual is not so controversial. Everybody can understand it. Focusing on how we've organized our society and the issue of justice, that's highly controversial. It's enormously complex, and it does provide the possibility for higher impact, given what we know from a lot of research. So Robert Wood Johnson Foundation a couple of years ago came out with a report that I think was, and it was a national report with lots of big-time people on it, that was just made one of the most significant statements I've ever heard. And I've referred to it a minute ago. When it comes to your health, your zip code may be more important than your genetic code. Think about what that means. When it comes to your health, your zip code may be more important than your genetic code. This is a great link for me to the epigenetics thing, because as I said, epigenetics is the process by which your zip code, the conditions in your zip code, literally get under your skin, create biological changes that influence your chances for health, disability, and wellness over your life course. It doesn't determine it, it influences. So this changes our focus from genes as inevitability to your genes as kind of, rather than being a blueprint for what's going to happen to you, just being a range of infinite possibilities that are determined by the interaction with the environment. So another thing that Robert Wood Johnson did that was very interesting was they created a number of maps, and this one is of Kansas City. And what they show here is that just within a couple of miles, this is life expectancy. There's another great one on Louisville. But just in terms of life expectancy, here is 71 years old, 69 years old, 83 years people live. 82 years. So just within what might be 15 or 20 miles, you have a 14 year difference in life expectancy. That's fundamentally an issue of place. It's not an issue of choice. It's not people who live in those zip codes aren't any different than anybody else. They don't have less of a desire for health than anybody else. But basically, what is happening there is you have the impact of place on people. And we now know that place has this epigenetic effect. So when you get to social determinants of health, we know that number one, they exist for almost every health outcome. There may be one exception around breast cancer. They exist as a gradient of risk. This is very important. It's not whether you're rich and poor, but it's in every, let's say you're in the top quadrant, the top 25% of people economically in the United States. If you're in the middle of that top 25%, your health outcomes on average, are going to be not as good as the health outcomes of people at the absolute top. So it's a gradient. It's like a stair step. If you're at the top step, your health is going to be better than if you're halfway down the stairs. These are strong and consistent findings. They predate formal research. You could go to the Titanic. You could look at the deaths on the Titanic, and you can look at them based on whether they were first class, second class, third class steerage passengers, and you can see this gradient. You could go to medieval times and look at gravestones of people, and you could determine by looking at the heraldry, the family history, and so forth and so on, that people who had the higher status had the longer lifespan. I mean, this is a consistent thing. It's not explained by traditional risk factors, being tobacco, being smoking, exercise, and diet. Even when you control for these things, you still see this. It's related to the social determinant, to the social distribution of wealth. And by the way, this gradient even exists in countries that have universal access to healthcare. So healthcare does not overcome this. So these are social class differences in health. Well, and I just said, social economic gradient is also found in countries with universal access to healthcare. They're found at the upper end, and they're found in treatable and untreatable diseases. Let me tell you an interesting thing. You take me, and you compare me in my, whatever my social economic position is, whatever my occupation and so forth is, with somebody in Germany or Norway or France who's just like me. So from a social economic perspective, that person will have better health outcomes than I have. Why is that? And this is a really important point that bears a lot of discussion. But because I live in a society, in a country, with much higher levels of inequality, we are all affected by the higher levels of inequality. So even though I am not at the bottom end or lower end, my health is still affected because of this interconnected principle that we all have. So this is an important thing. I was at a meeting the other day and I was talking to a community person, and she was saying, well, this doesn't affect you, it just affects my community. I said, no, you're wrong. It affects me because we are all interconnected. This is a fundamental public health and progressive value, the interconnectedness of people and places and policies. So then the issue comes up, is it more about race or is it about class? What about it? And the fact of the matter is, it is about both, but what we know is that race does have an independent additive effect. So if you control for social economic differences, it reduces the racial ethnic differences, but it doesn't do away with them. So there is an effect beyond just the SES effect. One of the best examples of this, if you are a college-educated African-American woman and you have a baby, your baby is more likely to look birth weight-wise like the baby of a white woman with a high school diploma than a white woman with a college education who should be your peer in terms of that. And it's because of the added impact, independent impact of the impact of racial discrimination. Because again, we haven't gone into stress in great detail, but this is one of the main aspects of stress. And stress has biological impact. So these disparities persisted over time at every level of income and education, and residential segregation, and I took out the slide on segregation, but if you look at segregated populations, there are specific things that segregated populations, by definition, don't have access to that affect their health status. So I want to leave you with two things. Number one is it's important to ask the right questions. So if we were asking an upstream question on health, we would say, what would Oregon look like if it were the healthiest place in the world? What would need to change? What kinds of policy change is necessary to make this happen? And how would that change be initiated, supported, and or accelerated? This is where we change our thinking, right? We're trying to take a step back and say, if we were to build everything anew, what would it look like? You know, there is a book called Theory of Justice. How many of you have heard of Theory of Justice? Were you telling me 2 minutes?
Oh, no, I was looking at that.
Because I do just have 2 more minutes. I saw I had an extra minute, so I'm going to throw this story in. So Theory of Justice is by a social philosopher named John Rawls. So John Rawls said, he created this thought experiment. He said, imagine you are in an original position and you have a veil of ignorance. The original position is that nothing exists. You are called on to design the world anew. And then the veil of ignorance is that you don't know where you would end up in society. You don't know if you'd end up in a high-rise in New York City or in Guyana, which is one of the poorest countries, highest mortality rates in the world. You don't know if you were born a male or a female, black, white, whatever. You don't know. This is the veil of ignorance. How would you design the world from the perspective of whatever? Transportation, economic opportunity, education. That begins to gives you the space to step back and say, what would the world really be like? And how would we guarantee justice or fairness in this? Because it's not just as simple as saying everybody ought to get everything, because that's not how it's ever going to work. But what are the trade-offs that we're willing to make? And I leave you with this final quote. Tom, anybody ever read Gravity's Rainbow? You go on, you're well read. I have to admit, I did not read it. Gravity's Rainbow is about 700 pages. It's a huge book. It's got this. So I saw this quote from Gravity's Rainbow. And I said, wow, this is an interesting quote, but I got to validate it. So I went out and I bought the book and then realized it was this big. I started reading it. It's like 4 books in one, it keeps going back. So what did I do? I'm never going to find this quote in 700 pages, so I did what any academic would do. I got a research assistant. And what did that research assistant do? They Googled the quote. And like in 1/1000th of a second, it ends up there's like hundreds of websites built around this quote. And it comes from a section in the book called Parables for Paradigms. But think about this. If they can get you asking the wrong questions, they don't have to worry about the answers. Think about that as a form of social control. Think about our media. Think about our educational system. I'm not presuming it's all bad or anything like that, but I'm just saying, think about these things. Think about how the questions are framed for us that lead us to pursue areas of inquiry that even if we are successful in pursuing those, it doesn't really move us forward. You, with the stage that you're in now, you have the ability to challenge those questions, to ask different questions. And I used to, when I taught at Berkeley, I used to say to my class, if there's one thing you can do, all of you at some point in your lives may be consultants. You may be informal consultants or you may be highly paid consultants. But I can tell you, being a consultant, the most important thing you can do as a consultant is to go into a situation and ask the question that nobody else asks. And it's easy to do because you're often in a situation where everybody is internal to that situation and they have blinders on that does not allow them to see. They don't have the perspective. So you always have to have that broader perspective. So don't be afraid to ask the question. Don't be afraid to challenge in a positive way. Don't be afraid to just say, well, why are we doing it this way? Because oftentimes the answer is not because it's the right way, it's because it's the way we've always done it. And for a lot of things, the way we've always done it, the way we've always done it has led us to a situation where we're still not in very good shape. So again, I appreciate the opportunity to talk with you. Thank you very much. It's a hot room.
Exactly why, and everything we're talking about, why Build exists, why we have EXITO, is so we can get different people asking different questions, right? So I know we're a little tight on time, but I really want to make space for, if people have questions or comments for Dr. Wallach. I think if you can stick with us for a few minutes, we'll just make space for it. Any questions? Yeah, Shannon?
Theory of justice, who's the author?
John Rawls, R-A-W-L-S. By the way, there's not only theory of justice, but somebody else wrote a book on how to understand theory of justice. But the quote there, I was fortunate in graduate school that I didn't read theory of justice, but the like 20 pages I read, it had the thing I just told you about. And then I went back and looked at notes and stuff like that. But that thought experiment is very interesting.
You mentioned the grading for socioeconomic status. What kind of specific factors that are due to that? Well, what kind of specific factors that are due to the social economic inequalities can lead to those worsened outcomes?
Great question. So when you look at the gradient, what is about it? It ends up that stress is a very important thing. So one study that was the basis for that was called the Whitehall study by Michael Marmot, when he looked at all of these civil service workers in England where they had clear demarcations of race. And what he found, for example, was during the workday, everybody's blood pressure goes up at work, you know, you just stress out. At night, when he followed people home at night, and he didn't. But when they measured people at night, what he found was that the higher up you were, your blood pressure went back down. But at the lower ends, your blood pressure never went back down. So you were at a stage of constant alert, right, where your immune system is constantly activated, which is not good. It's good when it gets activated when there's immediate threat, and then it goes back to normal. But if it's constantly activated, then it's creating wear and tear on the system that affects that. So stress is one of the major things. And then there's other things that would be related to that.
Stress and our ability to respond to stress.
Yeah, so I'm glad you mentioned that. There's two elements of stress. Number one is the stress that we have, and then our ability and the support that we have to manage it. Because not all stress is bad, right? This was a little stressful for me to get up in front of you guys, but you know, it builds my confidence. Hey, I did this talk in front of these guys, I can do another one maybe, you know? But if stress gets so high, it becomes debilitating. And that's the toxic stress. Or I could ask Dawn for help and tell me more about the class so I can better do it. So that lowers my stress because she said, oh, these guys are going to be interested in this and so forth.
And the types of stress we can't control, like residential segregation or violence in our communities.
Yeah, exactly.
Yeah. Did I see?
I was just going to mention, to kind of understand the economics of inequality in our society, there's a really good documentary called Inequality for All by Richard Wright, and it talks about just about inequality in our country, and so that kind of is kind of a little background.
Yeah. Good, there's a lot of good stuff. I mean, one thing is unnatural causes is inequality bad for our health, I think is the subtitle.
We're going to be watching it.
Okay, you are. The first hour of that, it really covers all this very well. Yeah.
This is more of a perspective question for you, but when you first began your study, was there as much of an emphasis on social inequality connected with health inequality as there is now? Or do you find that this is something that is really...
This is good news. When I started out in public health, very few people were talking about social inequality or social justice, quite honestly. There was a thread there, but it wasn't as woven into the whole fabric as it is now. One thing I point out is that in Multnomah County, we have a health department that applies an equity lens, and they may have a department of equity. If you had mentioned that 15, 20, 30 years ago, people wouldn't know what you were talking about. What equity? Why would a health department have an equity lens? So there's been a lot of changes, but we're kind of stalled because we know what the problem is, but we haven't developed the political will to create the kind of changes that we need to see.
With that, I was wondering, you or Don or anyone else here, you guys know like what kind of involved in any community besides obviously
So Dejanique's question is, you're someone who's here and you're like, I want to get involved, volunteer, or connect with a community-based organization, for example. Do we know any? And the answer is, so many. I won't actually go into specifics right here, but I think that we can, and I'm sure Larry has some comments too, but I can think of so many right now. It would take so much time, but we can certainly provide you with links and connections and ideas about how to get engaged. We can be really specific. Are you interested in segregation? Are you interested in education? I mean, there's a number of different areas that we can help connect you to people in the community that are doing this kind of work. Really like ground, on the ground, implementation, intervention work. Yeah. Larry?
Yeah, absolutely. I mean, I'm fortunate to be working with a number of organizations in East Portland who basically are social justice organizations. We're trying to get them involved in the epigenetics aspect of these things, because epigenetics is the ultimate social equity issue, because it's about people being born into an unequal starting position in the society. And then from that point on, rather than having stuff that helps people, the environment reinforces the initial inequity. So how do we focus people working on housing, people working on education, all these different areas? How do we focus them on creating this environment where health is the primary value?
I think going back to really your question and also touching on yours is I think there's a lot of us who are scientists who are very compelled by this evidence and feel like once you know this, you are called to intervene and you are responsible and accountable. And so I think a lot of us have intersected in those spaces to move science forward in ways that have impact on communities. Other questions? Yeah. John.
I was going to ask about the economic compression. Do you know if the United States was a healthier country back during the economic compression as compared to how the United States is currently?
Yeah. In terms of our relative standing with other countries, no question about it. Because in like late 50s, early 60s, we were like number 5 in the rankings. And now we're down, again, depending on how many countries are compared, but with our specific peers, we're down at the bottom, which is number 17. And again, what's happened is our health has improved over time, don't get me wrong, but the health of other countries has improved a lot faster. Look at Japan. Japan has the longest life expectancy in the world. Post-World War II, of course, they were a devastated society, right? And one of the reasons they have this longer life expectancy is because they are much more of an egalitarian society than we are. By the way, they have a much higher smoking rate than we have. Yet still, their life expectancy is the longest in the world.
Should we take one last question? Yeah.
So what are some of the social reforms that you're seeing put into place that you think are good as opposed to like that?
Well, this is pretty far out there. But the biggest social reform that would help public health is to reform financing of political campaigns. Because again, if this is about power and distribution of wealth, that financing has reinforced a lot of the conditions that give rise to these high levels of inequality.
The ones with the money they choose.
Yeah, they have undue influence on policy. So, that would be one of the main things. I'd say the second thing is because we now know the power of education, not health education, but education and opportunity is, I don't want to make you guys angry. I graduated from college with more money than I started from graduate school. And it's because I happened to go to college at a time at the peak where the United States said, we need to invest in higher education as a public good. Because the more educated people we have, the better off we are, even if any individual isn't that educated, but a better educated. And we have transformed that, beginning in the 70s, from a public good to something that's a private good that you only get if you can pay for it. And if you can't pay for it, you take out loans, and you've seen the impact of that, that you hobble your life chances. So I would look at those kinds of, reforming the system that develops these policies, who has a voice, increasing the voice of others. And the second thing is to really focus on economic and educational opportunity. And this program is a great example. I mean, I get very excited thinking about what all of you can accomplish and what all of you can do. Because you're going to have some of the same opportunities that I've had in terms of access to higher education. My father never graduated from high school. So it wasn't like I came from a line of privilege, didn't come from desperate straits, but I did take out loans to go to undergraduate school. But again, once I had some degree of success, the opportunity just expanded. And that's the balance of the individual work. And then the society needs to reward that individual work. The society's not rewarding it anymore. So you guys, I'm hoping that that's going to work for you.
Excellent. Thank you so much.